season preparations are underway as vaccine manufacturers are stepping up production. The four major makers of flu shots together say they plan to supply almost 200 million doses of the vaccine to the U.S. That's up from about 170 million last season. Fewer than half of American adults and about 60% of kids typically get a flu shot each year. But now public health officials say they plan an even greater push for vaccinations because of the COVID-19 pandemic. But when is the best time to get a flu shot? We asked a family physician for their opinion. We now welcome Dr. Raquel Yankee, a family physician with St. Agnes Medical Center. Dr. Yankee, thanks so much for joining us. And flu season, of course, is approaching. And how much of a concern is this for you and your patients, being that we're in the middle of a pandemic as well?
This has been a concern for most of us in the medical community, honestly, since the pandemic hit back in March. Definitely in April and May, we already started thinking about what we would need to do differently for this flu season, given the fact that there would likely be this co-infection going on too. When we heard that the possibility of the coronavirus being more cyclic in nature and understanding that meant that it would likely kind of calm down, as we have thankfully seen it doing across our country in the last few days, although there still are a few states that are hot spots and see an increase in numbers. We are now preparing actively for the flu season as we speak.
I know there is some concern that there may be some individuals that get both viruses, the flu and COVID. Do you think that's a possibility? And how will that complicate treatments, being that the symptoms are similar in some cases?
The challenge, you are exactly correct. And if you recall, so the flu season annually, the peak months for that in our country and in this part of the country, in fact, are closer to November, December, January, February into March. And so when the pandemic started in our last year, it was actually the tail end of flu season. So in fact, we did see people who had flu as well as COVID were diagnosed with the COVID virus at that point. And you are exactly correct. It was very challenging to diagnose between the two because some of the symptoms, such as cough, shortness of breath, fever, fatigue, body aches, are exactly the same. So it is challenging. And what we are going to have to do in this situation is testing, most likely in a lot of situations for both, is going to likely be the greatest recommendation, because there will be no way to differentiate unless, of course, someone has recently had the coronavirus. Then you may be able to exclude that. But again, because so little is known, we don't know how far back does that mean? How long, once you've had it, do you have immunity? Because there are instances that we're seeing now across the world where people are becoming reinfected.
That's right. Now, a good portion of the community is already wearing a mask. And are the precautions that we're taking to protect us from coronavirus, could those potentially protect us from getting the flu as well? And maybe ultimately it won't be a bad flu season? What are your thoughts about the protection that we're already using?
The PPE, or the protective measures that are in place right now, most certainly will help us. However, the biggest thing that we can do this year is get vaccinated with the influenza virus. Get vaccinated to prevent the influenza virus. Doing that, as well as continuing to wash your hands and follow some social distancing practices, is the greatest thing that we can do. Because the real risk is every year at the peak seasons, you have hundreds of thousands of visits across our nation to hospitals, to doctor's office, emergency rooms for flu-related illnesses. There's a lot of complications that occur that put an increased stress on our hospital and healthcare systems. Now we are already stressed because of the COVID-19 and the emissions with the coronavirus. So getting vaccinated will help prevent that extra undue burden to that system because it'll decrease the amount of people who come in with those symptoms. For in this season, anybody who comes in with those symptoms, we have to treat as if they have the coronavirus because it's a much deadlier illness.
That's right. Now, I'm noticing that a lot of the local drugstores and pharmacies are advertising flu shots. Is it too early to get one, being that, as you mentioned, flu season goes all the way into, it will go all the way into March of next year. So if we get a shot now, here in early September, will that provide us with enough protection to get us through that whole flu season, or should we hold off for a few weeks?
Honestly, I have this discussion every day. Most of us in the medical community would recommend holding off at least a few more weeks because for those exact same reasons. It takes a couple weeks to develop immunity, so some people are really interested in getting it now. However, when you think of when the peak of the likelihood of flu is, you're going to be pushing that towards, January, potentially into February, March in some places. And the vaccine will not be as potent in your system, particularly for those folks who are at high risk, which are sometimes our elderly, the younger children, those who are otherwise immunocompromised to begin with, like COPD, chronic asthma, bronchitis, cardiovascular illnesses, stroke, cancers. Those high risk individuals definitely need to be vaccinated, but most of us would agree that later in September, early October would ideally. I personally tend to wait until October, mid to late October, but this year we just really want people to get vaccinated.
Well, it is something for us to certainly think about for the next couple of weeks. Our thanks to Dr. Raquel Yankee, a family physician with St. Agnes. We sure appreciate your thoughts today.